Good day, sir. I am Chris Madaltayopan, your nursing aide for today, and today we're going to demonstrate postpartum care. So the purposes of this procedure is to aid in preserving physical appearance of the disease, to prevent discoloration and damage of the corpse skin, then to safeguard all the belongings of the deceased, to support family members during initial hours of their bereavement, then to show respect for the deceased. Then next for assessment, first we're going to check the vital function and notify the physician. Afterwards, we are going to review the hospital policy regarding postmortem care and the notification process, then the need for autopsy if the client's death occurs within 24 hours of hospitalization or its result from suicide, homicide, or if it's requested by the family member for the autopsy. Then for outcome identification, body and environment are clean and with natural appearance. Then family view the body with no extreme distress at its physical appearance. Then there is no contact with body fluids. Then next for implementation, we need to note in the client's chart the time of death, the time of death announced by the physician or any other appropriate authority. Then next, notify the client's family that the status of the client changed to worse and assist them in private room until the physician is available. Then next, return to the room of the client and close the door. Then afterwards, we're going to perform hand hygiene. Then done gloves. Then wear isolation gown. Next, we are going to remove the tubes of the client, such as IV, catheter tubing, NG, and other tubes. Then next, then autopsy is to be done. Then we are going to hold the eyelid of the client. If it is open, to remain closed. But if the eyelid is not remain closed, we are going to place 4x4 gauze or cotton balls so that it will remain closed. Then afterwards, if there is some tubings that are unable to remove, we are going to clamp the tube near to we are going to clamp it, clamp IV and tube, then coil engine and urinary tubes, and coil them down, and cut IV tubing. Then afterwards, we're going to remove extra equipment from room to utility room. And afterwards, then next we are going to wash secretions from face and the body. Afterwards, we are going to replace soiled linens and gown with clean articles. Afterwards, put salt in pad in the bag and remove from the room. Then position the client in supine position and place the arm at the side. Then we are going to place dentures in mouth and put pillow under the head and place a roll towel under the chin to remain his mouth closed. And next, we are going to remove all jewelries except the wedding band, unless it was requested by the family. Then give all personal belongings to the client. Then do not forget to write the receiver's names in the chart. Then we need to record it, all the names that received the personal belongings of the deceased. Then we're going to replace top cover. Then place chair at the bedside. Then next, dim lighting. Then after body has been viewed by family, tag client with appropriate identification. Next, send complete death certificate with body to funeral home or complete paper work required by hospital, and send body to the morgue. Then next, we're going to close the doors of clients on hall through which body is transported if hospital policy. Then restore and dispose of equipment, supplies, and linens properly. Then remove gown and gloves and perform hand hygiene. Next, after performing hand hygiene, so for evaluation, desired outcome was met when body and environment are clean and natural appearance. Then there is no the family views body with no extreme extreme distress appears on its physical appearance. Then there is no contact with body fluids, the nurse, the staff, and the others. Then next, for documentation, we need to document the time of death and code of information if used. Then the notification of physician and family members' reaction towards the disposal of the belongings, personal belongings. Then other response of the clients for the disposal of belongings of the clients, and the time the disease was transferred to other place from the room. Then the location of the disease transferred, so from the cardiology ward, the patient was transferred to merge, and the patient's name is Kepwing Zitiwarsho, diagnosed for chronic heart disease. Time of death was 10 a.m. and date of death was February 5, 2021 from the ward of cardiology.